Hey everyone, this is the Pragmatic PT, and today I want to discuss the truth about subacromial decompression surgery. As always, this video reflects my personal opinion based on my own interpretation of literature. This video is intended to be a source of information and not medical advice. So if you are currently dealing with an injury, I highly suggest you seek help from a qualified medical professional. So, subacromial decompression surgery is a common procedure that is performed for individuals who are struggling with, you guessed it, subacromial pain syndrome, or SAPS. This is also commonly known as shoulder impingement and is also sometimes referred to as rotator cuff disease. The surgery mainly consists of the removal of the subacromial bursa, the shaving down of the underside of the acromion, and the resection of the coracoacromial ligament. All this is done to create space between the acromion process and the humeral head in an attempt to minimize the impingement of these structures. This is another surgery that has gained steam throughout the years, with one study noting that the surgery has increased sevenfold from 2000 to 2010 in the UK and fourfold from 1996 to 2006 in the US. Now these numbers appear to make sense as shoulder pain is a major issue for many individuals, with impingement being responsible for up to 85% of all shoulder pain. In the UK, for example, 1 in 50 adults will seek treatment for shoulder pain each year. Now I have my own thoughts regarding shoulder impingement and the issues with a generalized diagnosis such as that, but I'll have to make a separate video for that topic. Regardless, chronic shoulder pain is a major problem and surgery is becoming much more common as it continues to be less invasive with recovery times that are getting shorter and shorter. So on the surface, the biomechanical explanation seems to make sense and it would be reasonable for this surgery to result in less pain and discomfort in the long run. Well, let's just take a look at the research and see what it says. Very recently, 2 separate systematic reviews with meta-analysis were released looking at non-operative treatments or sham surgeries versus subacromial decompression surgery. Both of these studies' main outcomes were to look at the patient's perception of shoulder function, their quality of life, perceived pain, and several other subjective reports of function. Although no study is perfect, so all results should be taken with a grain of salt, it appears that based on these 2 studies, we have a reasonable idea, on average at least, for the effectiveness of these surgeries. So as it turns out, both of these studies came to the same conclusion. The main finding is that surgery doesn't appear to be of important benefit when looking at functional outcomes for patients either in the short or the long term. Okay, now let's dig a little deeper into the results of these studies. When taking a look at this first graph, we can see pain rating from 0 to 10 on the y-axis and time in months on the x-axis. It is noteworthy that pain is improving with all treatments, but the difference between treatments is negligible. With the visual analog scale, a change of 1.5 points is needed to be considered minimally important difference, and that is clearly not seen, especially when you take a look at the confidence intervals of all the treatments. The second graph we're going to look at here shows function from 0 to 100 on the y-axis and time in months again on the x-axis. As seen with pain, function improves with all treatments, but does not vary greatly among the different treatments, and the minimally important difference here is 8.3 points. So as you can see when looking at both graphs, we don't reach that number that is considered to be minimally important difference on either pain or function. Now I know I just used the term minimally important difference a few times, so let me explain things just a bit more. When looking at the results, it's worth noting that there were some statistically significant differences in favor of surgery. On the surface, this sounds pretty clear-cut in terms of surgery being more effective, but statistical significance and clinically or minimally important difference is what we really care about here. Statistical significance many times indicates a very small difference that the person would not recognize as being meaningful for their everyday function or the perception of symptoms. For example, in one of the studies, a small statistical significance was noted for surgery in the long-term functional outcomes when using the constant Murley score. The important thing to remember here, however, is that a score change of 10.4 points is required to be considered minimally important difference for this functional scale. So although statistical significance was seen, they actually only saw a 2.51 point change on this scale, which is far below the 10.4 points that's required to be of minimally important difference. So all in all, it appears that surgery is not a very effective treatment for shoulder impingement. Now, I'm not discounting the benefits of surgery for many people, as studies in general are looking at averages and don't take into account all of the outliers. As with any treatment, individuals will respond, well, individually, so some may actually get fantastic results, and I wouldn't fault anyone for trying to go under the knife to get out of chronic shoulder pain. Having said that, we do need to look at these studies in general to determine their effectiveness and figure out who those outliers are who will benefit most from the surgery. The goal here is not to demonize surgery, but to advocate for more research and the appropriate application of surgery. Said another way, we just need to figure out how to find those individuals who will actually benefit significantly from the surgery. And probably the most important thing of note is that patients continue to struggle with pain regardless of the treatment they get. One study noted that patients reported pain of 1.5 to 3 out of 10 on a visual analog scale for up to 5 years after treatment. So we clearly have more work to do when trying to help people in shoulder pain.